Alsharef, a senior medical student at King Saud bin Abdulaziz University for his science in Jeddah, Saudi Arabia. First of all, I'm passionate about orthopedic surgery as well as the orthopedic research project, and I consider myself as a junior researcher. Thank you for giving me the pleasure to present in front of you, and it's my pleasure actually. So let's start. Today, in the next few minutes, I'm going to present our updated systematic review and meta-analysis, in which we aimed to compare the botulinum toxin type A injection versus placebo injection for lower limb lengthening deformity and deformity correction. So, okay. To further introduce the topic, botulinum toxin type A is the most popular therapeutic agent for muscle relaxation and pain control. Lately, botulinum toxin type A injection received a great interest as a part of multimodal pain management for lower limb lengthening and deformity correction. So, a simple question: what is botulinum toxin type A and how does it work? As you can see in the normal process, we have the nerve, we have the neuromuscular injection, the neuromuscular junction, as well as the muscle. We have the acetylcholine as well as the vesicles of acetylcholine. So if we have action potential going through the nerve, the vesicles will open and the acetylcholine will be released into the cleft and binding into its receptor, leading to muscle contraction. What will happen actually, and the other side, which is after the injection of botulinum toxin type A, the Botox will work as a blocker for the release of botulinum toxin type A, leading to contraction, blockage, as well as the muscle will be relaxed. Hence, botulinum toxin type A is used as a paralytic agent as well as a pain control agent. So what is the significance of our study? Recently, there is a number of randomized control trials has been introduced to the literature comparing the botulinum toxin type A injection versus the placebo or intraoperative placebo injection or the normal saline injection. And a debate was raised about the routine use of botulinum toxin type A injection during such procedures. And up to our knowledge, there was no systematic review and meta-analysis concerning this topic. So we raised the question: in individuals who are undergoing surgical lower limb lengthening correction and or deformity correction, is intraoperative botulinum toxin type A injection more effective and safer than placebo injection with using the normal saline in terms of pain on visual analog scale, range of motion measures, as well as average opioid consumption and adverse events such as muscle contracture and joint stiffness? And to meet our goal, only randomized control trials has been introduced in this study. So this study was done based on a pre-specified protocol following the preferred reporting items for systematic reviews and meta-analysis, i.e. PRISMA checklist. As you can see in the screen, our registration ID number. After a comprehensive search through Ovid Engine in 3 databases, we started with a total number of records equal to 1,380 studies. And after the screening steps were done and the deduplication steps also, we included 4 eligible RCTs with a total number of patients equal to 257. The participants' age ranged from 11.8 years old up to 26 years old. And the total number of limbs that were operated on was equal to 337. 173 limbs out of them received the intraoperative botulinum toxin type A injection, and the rest were randomized into intraoperative placebo injection. Tibia was the most reported site of surgery, followed by femur, then foot, and lastly, a combination of both tibia and foot. So after the data extraction step were done, we conducted the meta-analysis by using the Review Manager software version 5.3. And to combine our result, we used the random effect model. All the results that fall within 95% confidence interval with a p-value less than or equal 0.05 were considered statistically significant. We assessed the heterogeneity by using the I-square test and the p-value of chi-square test. Risk ratio was used to represent all the dichotomous outcomes, such as adverse events, whereas the standardized mean difference was used to represent the continuous outcomes, such as pain on visual analog scale. We use the Cochrane risk of bias tool to assess the quality of the studies, whereas the publication bias were visually inspected through funnel plot. And we assessed and checked the evidence for each outcome by using the grade criteria. So here, as you can see in figure 3 RCTs were classified as low risk of bias, whereas only one, which was Hamdi, that was done in 2009, were classified as unclear risk of bias, and this is due to a randomization issue in that study. Upon visual inspection of the funnel plot for all the outcomes, it was symmetrical. Hence, there was no publication bias detected in our study. So here's the overall result of our meta-analysis in table 2. As you can see, for the pain of visual alike scale, it was statistically significant difference. There was a statistically significant difference favoring the botulinum toxin type A injection with a p-value equal to 0.02. Whereas in terms of adverse event, it was comparable between the two arms. The heterogeneity for both outcomes were statistically insignificant. So now let's talk about each individual outcomes. Starting with the pain on visual alike scale. Here's the first plot in figure 2. As you can see, all the included 4 RCTs reported data on this outcome, giving us a p-value equal to 0.02, which is statistically significant number. And this is actually confirmed by the location of the diamond. As you can see, do you see the cursor on the screen? Okay. So I'm right now pointing on the diamond. As you can see, it was confirmed by the location of this diamond, which is favoring the botulinum toxin type A arm. Hence, pain on visual alike scale was significantly lower in botulinum toxin type A injection compared to placebo injection. Moving to the next outcome, which is the adverse event. Also, all included RCTs were reported data on this outcome, giving us a statistically insignificant value equal to 0.02, which is also confirmed by the intersection of this diamond, as you can see in the screen, with that line of no effect. Hence, there was no difference found between the two arms in terms of adverse event. Moving to the next outcome, which is average opioid consumption. Only 2 RCTs reported data about average opioid consumption. And it was, unfortunately, we couldn't perform a meta-analysis on this outcome due to insufficient amount of available information. But we did the descriptive analysis leading to or showing us similar average opioid consumption in the 2 groups. For the range of motion, data on this outcome was reported by using 3 RCTs. And also, we couldn't perform the meta-analysis due to insufficient amount of data, but we did the descriptive analysis, and it showed no difference between the groups, and it was comparable between the 2 arms. So in this figure, as you can see, the grade criteria was assessed as moderate for all the outcomes. And this is due to the small sample size that affected the imprecision domain. So in contrast to all RCTs, PERC-ATL compared or reported that pain was not elevated with the injection of botulinum toxin type A. And we believe this could be due to the different doses or injection site of botulinum toxin type A. Therefore, our recommendation for the routine use of botulinum toxin injection during lower limb lengthening or deformity correction is modest. Hence, further high-quality RCTs with a larger sample size and a longer follow-up duration following adjuvant botulinum toxin type A injection are warranted, taking the differences that I just mentioned into consideration. So we believe that, and to the best of our knowledge, that this is the first systematic review and meta-analysis on this topic, including a high quality of evidence data. We acknowledge that our study has some limited number of studies, as well as a relatively short sample size with a short follow-up period. In conclusion, adjuvant botulinum toxin type A injection showed a significant improvement in post-operative muscle pain compared to placebo, whereas there was no differences between the 2 arms in terms of adverse events, range of motion parameters, as well as average opioid consumption. It is worth mentioning that our study has been published recently in Journal of Orthopedic Sciences, as you can see. For the published article and more references, here's you can scan the QR code. Here's my contacts. Thank you for your attention and listening, and I'm ready